The testosterone deficiency not only influences the ability to build muscles and strength, but also has a significant impact on daily activities and mental state. From consistently low energy and mood swings to heart problems and reduced libido, if left untreated, low testosterone can become a serious issue. If you suspect you may have low testosterone and experience some common symptoms such as reduced sex drive, erectile dysfunction, body hair loss, muscle loss, low energy, weight gain, or signs of depression, it's important to seek evaluation from a medical professional. However, before considering options like testosterone injections or risky medications, it's advisable to focus on simple changes that can make a big difference in testosterone levels. So, in this video, I'll share the top 8 factors that harm testosterone and should be avoided, so you can restore your hormones naturally. Without further ado, let's get started. Poor sleep. A study published in the Journal of the American Medical Association indicates that lack of sleep can have a significant impact on testosterone levels. Healthy young men who slept less than 5 hours per night for just 1 week experienced a reduction in testosterone levels equivalent to aging 10 to 15 years. Therefore, in addition to significantly affecting sexual function, inadequate sleep can also impair the ability to build muscles and gain strength. Excess body fat. A study conducted and published in the European Journal of Endocrinology followed over 2,000 men aged 40 and older for approximately 4 years. The results indicated that fluctuations in body weight were directly related to changes in testosterone levels. In summary, individuals who lost 15% or more of their body weight experienced an increase in testosterone levels, while those who gained 15% or more of their body weight showed a significant reduction in testosterone levels. This does not imply that achieving an extreme level of leanness is necessary to optimize your hormone levels, but rather that maintaining a healthy amount of body fat can have a positive impact on your testosterone levels. Refined carbohydrates. It is widely known that a diet high in sugar is unhealthy, mainly because refined carbohydrates do not offer the same nutrient density and fiber content as naturally occurring complex carbohydrates. These simple carbohydrates consist of short-chain sugar molecules that are quickly digested and converted into energy or stored as body fat. Excessive sugar consumption in the diet can lead to irregular blood sugar levels, energy fluctuations, and ultimately a decrease in testosterone levels. A study published in the Journal of Nutrients found that men who consumed high amounts of bread, cakes, and desserts had lower testosterone levels, less muscle mass, and more body fat. This does not mean that you need to completely eliminate your favorite treats, but it is important to consume them in moderation. The majority of your carbohydrates should come from complex sources like sweet potatoes, brown rice, and oats. Additionally, increasing consumption of leafy green vegetables and fruits is crucial. If most of your carbohydrates come from complex sources, an occasional sweet treat will not have a significant impact on your health. Lack of physical activity. The lack of regular physical activity not only negatively affects heart health but can also reduce testosterone levels. With the advancement of technology and easier access to food, along with other lifestyle factors, we are becoming increasingly less active as a society. According to the Centers for Disease Control and Prevention, only 28% of Americans are meeting the recommended guidelines for physical activity. A study published in the American Journal of Epidemiology followed over 1,200 young men for 4 years to understand how hormone levels were influenced by sedentary habits. They found that those who spent about 5 hours watching TV had lower testosterone levels compared to more active individuals. Another study, published in the Journal of Physiology and Pharmacology, examined the effects of short-term physical activity on testosterone levels in sedentary men. They concluded that just 15 minutes of exercise every other day for 12 weeks resulted in a significant improvement in testosterone levels. Therefore, whether it's incorporating weightlifting sessions a few times a week, biking more regularly, or going on regular walks, increasing physical activity is crucial to maintaining healthy testosterone levels. Medications for treating hair loss are widely used in the United States to halt hair loss. Although effective, they come with associated downsides. Hair loss, fundamentally, is triggered by an overproduction and sensitivity to testosterone. While not a universal experience, genetically predisposed men often face this issue. These medications aim to prevent the conversion of testosterone into other active substances. A study published in the Journal of Steroid Biochemistry and Molecular Biology examined men using these medications long-term and how their hormones reacted when they stopped treatment. This resulted in reduced libido, impaired sexual function, and symptoms of depression. Additionally, hormone levels remained dysregulated after discontinuation. While it's not advisable to eliminate these medications as an option, it's prudent to explore other alternatives before making a definitive decision. Excessive alcohol consumption studies show that excessive alcohol consumption is associated with decreased testosterone levels and increased cortisol levels. Furthermore, there is a proportional relationship between the amount of alcohol consumed and the reduction in testosterone levels, meaning the more alcohol you consume, the more your testosterone levels decrease. While it's not advisable to completely avoid alcohol, it's advisable to consume it in moderation to minimize the negative effects on testosterone levels and overall health. High levels of stress. High levels of stress and anxiety are common situations we face in life. Some days are calmer, with reduced stress, productive workouts, and positive outcomes. On the other hand, some days are hectic, leaving us exhausted and affecting our performance in workouts. While short periods of stress and anxiety are manageable and temporary, chronic stress can be more problematic. Prolonged stress can affect the balance of our hormones, especially testosterone levels. Testosterone naturally fluctuates throughout the day, but constant exposure to high levels of stress or anxiety can have negative consequences. A study published in the Journal of Anesthesia examined pain sensitivity, anxiety levels, and hormones in 46 healthy men in different situations, including restful and stressful moments. The results indicated that high levels of stress were associated with a reduction in testosterone levels. Trans fats. In 2016, the FDA banned the use of partially hydrogenated oils due to their deemed safety hazards. However, trans fats can still be found in processed foods such as cakes, fried foods, and pizza. While we typically associate these fats with heart issues and other diseases, they can also have a negative impact on our hormones. A study published in the Asian Journal of Andrology examined the relationship between fat intake and levels of reproductive hormones and testicular volume in men. The results showed that diets high in trans fats were associated with lower testosterone levels.